Hi, it's Paul Slackus, Good News Broadcast, speaking to Dr. Lisa Masterson. Hi, doctor. How are you?
Oh, great. How are you doing?
Okay, good. Unfortunately, it's a radio interview, but I see you all the time on television, on network television. Congratulations.
Oh, well, thank you. I'm really enjoying the show and so happy to have a platform to speak to everyone globally about health issues. So that's fabulous in an entertaining way. We try and make it fun.
Well, you guys are a fun bunch, you know, overall, and you're the only lady on the crowd there, right?
I'm the only lady, so it's a great platform to have to be able to educate and empower women again globally. So it's I'm really happy to have that spot.
You know, in a serious note, of course, you're an MD, specialist in obstetrics and gynecology, sorry, infertility, adolescent gynecology, family planning. You know, you're involved with Cedars-Sinai Medical Center, and you're doing good. I saw a nice piece on you on TV Guide channel, I think it was, where you were in Africa. Was that right? And doing some good things there?
Yes, and that's something that's close to my heart, where I'm trying to decrease maternal mortality across the country, but what I want to talk to you about today is a little reverse about that, and
Sure.
Educating women. I've been working with First Response to educate women about their body. A lot of women don't realize that infertility affects a huge number of people. 7.3 million people, or 1 in 8 couples. And a lot of women, are planning their careers and their education, but they're not planning ahead for their families. So it's very important to educate them about the fact that infertility affects a lot of people, and that actually your fertility starts to decline at age 27. And, that's very important for women to know that their biological clock is ticking, not to scare any women, but so that they can plan ahead and get rid of some of these misconceptions about conception.
Mm-hmm. Well, what are some things that a woman can do?
Well, what she can do, best thing she can do is know her body. In conjunction with First Response, we did a survey where we found 3 in 4 women of childbearing age do not know what FSH is. And FSH is a sort of fertility factor. Basically, it's produced by the pituitary in the brain of a woman, and it basically dictates how many eggs are released every month. And the fewer eggs you have released, the higher that number goes. And so this actually sort of checks your pregnancy potential or your ovarian reserve. And by doing this, a woman can kind of find out what her future fertility potential is. And we usually, as an OBGYN, we do this in our office as a blood test. But now First Response has developed, and I love this because we get cutting-edge, kits on the show, and I'm able to talk about them, right off the bat, is they have developed a new kit where a woman can measure this FSH over the counter, and it's not a blood draw anymore. She can just urinate on a stick, just like the pregnancy test, just pee on a stick type of thing.
Mm-hmm.
Get the results back in like 30 minutes in the comfort of her own home. It's affordable in this economy, so she doesn't have to pay the extra doctor's expense and blood draw expense and all that, and really get a head start on finding out about her fertility future.
Okay. And what is that? Is there a product there that does that?
Yeah, it's a fertility kit over the counter. Again, it's just almost like a pregnancy test stick that you urinate on, and it's good in that if it comes back normal, then you can try for 3 to 6 months, depending on the woman's age, to get pregnant. If she doesn't, and if she doesn't get pregnant, she should go into her doctor. And if the test comes back abnormal or high FSH, then she should go into her doctor right away and find out, if there's anything she needs to do about it, or take fertility medications, or what needs to happen. So it's a really good way for a woman to get a jump start into a conversation with her doctor.
So and it's called First Response. I'm looking at a website called First Response, right? And it says Fertility Test. And is that what it's called?
Kit. Yeah, it's the new fertility kit by First Response.
Okay.
And other tips to take control of fertility for women, besides planning ahead, testing your FSH, is to take a prenatal vitamin at least 3 months ahead of time. It's really important.
So I'm looking I see here, just because I don't know much about in this regard here. Okay, so the one's a fertility test.
That's what I'm here to do.
All right, so, and men need to know these things. I'm Grandpa Paul here, so I've been through a little bit of this, so the first thing is a fertility test. So now you take a fertility test, late 20s, or you start to get to know your body a little bit better?
Right.
Okay.
Exactly.
And what's an ovulation test? That's to start, and people are taking that time out to do. Well, that's another situation,
That's
right?
another step. So say your FSH came back normal. Then you would want to, and again, First Response, a big champion in women's research and testing kits. They have an ovulation kit that checks every day of the month. So it's very accurate. It helps to find out when a woman's ovulating because, again, women think it's so easy to get pregnant, but you have to have the right time of the month. So once you've done your FSH and you know that everything's fine, then you can try and figure out when you're ovulating, do timed intercourse, try and pinpoint the specific timing window when you should have intercourse, and that really helps. And then the next thing you'd want to get is a pregnancy.
I know, I'm looking at it. They got everything covered here.
They got it all in one package.
It's good, and it's the greatest thing in the world. There's nothing better than this, right?
Well, then having a family, absolutely.
That's all about family. I love it. It's so good. But to be smart about it, it's very, first of all, to begin with, you need to be responsible and respectful about the whole situation, right? Wouldn't you say that?
Exactly. That's why planning is important all the way around. You know, so when a woman starts to think about her career, she should start to think about when she's going to want her family, and then start to think about, always thinking about actually living a healthy lifestyle so that she can preserve her fertility. So it's really important. But again, once a woman knows how her body works and how she's wired, very, very key factors.
Sure, because then you can also plan not to have a child at that point. If you don't want to have a child, then if you know you're ovulating, then maybe that's a time to be more protective?
Well, you don't use the ovulation kits for family planning. For not having babies. You use those when you want to have babies, because it's not a good withdrawal, and that method is not as accurate as you might want to see. But definitely, women, when they're trying to talk about contraception, they should talk that over with their doctors.
Okay. All right. Well, congratulations once again. Last question. What's good news for Dr. Lisa Masterson?
What's good news for me?
Yes. What's good news for you?
Well, the show and all the positive things that are out there for women to try. I mean, life's very good. I really like having the platform to be able to talk about these medical issues to the whole world, and again, to be able to help women all across the globe. And you're really good at it. I'll let you know. That's what I think. Oh, thank you. Thanks, Doctor. Talk to you soon. Bye-bye.